How's it going, guys? We have a past level question for Pharm for step 1. 51-year-old man, HIV, 2-day history, Rager's chills, high fever. He has invasive aspergillosis. Intravenous caspofungin is initiated, inhibition of which the following best explains the efficacy of this pharmacologic agent. Let's just hop through the answers here. Choice A, carbohydrate synthesis, correct answer. So you need to know that the echinocandins, i.e. caspofungin, micafungin, inhibit beta-glucan carbohydrate synthesis, beta-1,3-glucan carbohydrate synthesis. Okay, so cell wall synthesis, glucan cell wall. So they can give you any number of variations of glucan, carbohydrate, cell wall, and that's echinocandins. Shows up all of the MBME exams. It's to my observation, caspofungin and micafungin, the echinocandins, are the highest yield antifungals in USMLE. Okay, so you don't need to worry about use cases. Invasive aspergillosis tends to be a textbook perpetuated use case, but USMLE is not going to ask you about when to use it. They just want the mechanism of action as I just described. Let's just hop through the others here. Choice B, ergosterol synthesis, wrong fucking answer. This is azoles, i.e. fluconazole, most commonly. So esophageal candidiasis, oral fluconazole. They ask for an oral agent for vulvovaginal candidiasis. It's going to be oral fluconazole. General cutaneous candida, oral fluconazole. Simple / uncomplicated fungal pneumonias, oral fluconazole. Okay. Tinea corporis, ringworm, that's going to be topical. So clotrimazole, miconazole. Sometimes tinea pedis can be topical azoles. Sporotrichosis, itraconazole. Let's just hop through the others here. Choice C, lanosterol synthesis, wrong fucking answer. So that's going to be terbinafine. All right, so terbinafine inhibits the conversion of squalene into lanosterol via squalene epoxidase. And you could be aware that oral terbinafine is used for onychomycosis, that's nail bed fungus. And topical terbinafine sprays, foams can be used for tinea pedis the same way that topical azoles, clotrimazole, miconazole can be used for tinea pedis. Wrong fucking answer. Choice D, P450 mediated demethylation, wrong fucking answer. This refers to azoles, same as choice B. Okay, so the conversion of lanosterol to ergosterol is via an enzyme called 14-demethylase. And they asked this straight up in one of the NBME exams. They say the oral agent responsible, or the oral agent given to treat vulvovaginal candidiasis in this patient inhibits which of the following? And the answer is P450 mediated demethylation. And that strikes students as obscure. It's not. I've harped on this in my content. Okay, so wrong fucking answer. Choice C, tubulin, wrong fucking answer. Refers to griseofulvin. So griseofulvin inhibits microtubules, but OMG, USMLE will just have tubulin as an answer sometimes. So griseofulvin, they do want you to know for family medicine for TCK that it's used orally for tinea capitis, and it's for patient only, not patient and classmates. So they'll give you a circular area of scaling alopecia on the scalp, and that's tinea capitis. Oral griseofulvin for patient only. Avoidance of sharing of hats is the #1 way to prevent it. And don't confuse tinea capitis with seborrheic dermatitis, which is dandruff. That's itchy scalp. Sometimes can be weeping papules in the hairline. You're going to use topical azoles, topical selenium shampoo for seborrheic dermatitis. And we didn't mention it, but you should know that nystatin and amphotericin B both have the mechanism of action of forming pores or holes in the ergosterol cell membrane. So ergosterol, as I probably should have mentioned before, is the cholesterol equivalent in fungal cell membranes. Don't confuse with cell wall, which we said was glucan carbohydrate synthesis, the echinocandins, but amphotericin B and nystatin poke holes in the ergosterol membrane. Nystatin mouthwash is used for oropharyngeal candidiasis. Topical nystatin can be used for vulvovaginal candidiasis if the patient is not given oral fluconazole. Amphotericin B is a hard-hitting antifungal used for invasive conditions, such as in this case. We could easily use amphotericin B here as well as patients who have CNS fungal infections, i.e. Cryptococcus neoformans meningitis. Wrong fucking answer. You know the deal. I'm just to make more content. If you like my stuff, subscribe to my channel. I appreciate your time. That's it.